Good afternoon, friends. I am Dr. Amol Vadgaonkar. I am consultant gastroenterologist at Sir H.N. Reliance Hospital, and today I'm going to speak to you on topic of staying safe during monsoon and maintaining our gut health. So, as we all know, that monsoon is the most loved season of all the seasons, and especially the children who get drenched in the monsoon, and all the elderly they go on trip or trekking, and there are some street foods which we like to indulge in. So we should think that there can be upsurge in the gut related ailments during this monsoon season, and the Mumbai has alone reported at least 6677 cases of gastroenteritis till now, that is June 2023, and which is 25% increase in the cases as compared to last year. So how monsoon changes the plot? So one first thing is that there is change in the temperature. There are fluctuation in the temperature and humidity, so which leads to growth and survival of the germs, which lead to contamination, and there is transmission of germs through food, water, contaminated hands, flies, and etc. So, as we all know, if there is stagnation of water in the vicinity, which may be in the fields, or there may be stagnation of water in the earthen pots or some tires, sometimes the animals which are breeding in the fields, and also the undisposed waste products. So, what are the common complaints that the patient presents with? So, most commonly, patient presents with nausea, vomiting, bloating, flatulence, indigestion, diarrhea, bloody diarrhea, constipation, and fever. So, what are the most common monsoon related gut diseases? Uh, to name a few, most commonly are the common diarrhea, which is a non infective diarrhea, and which presents with loose motions. These are usually self limiting. Sometimes there can be infective cause to it, and it is treated by adequate hydration, ORS water, antibiotics if required, and probiotics. Also, a patient should be on little bland diet. Dysentery. The dysentery is is a type of diarrhea where there is along with diarrhea there is blood and mucus in the stool, and there is abdominal pain, fever, and tenesmus also. Usually, this is caused by bacterial infection like Shigella, Campylobacter jejuni, Salmonella typhi, or amoebiasis. And the blood test usually required are common: the complete blood count, uh, stool routine, stool culture, blood culture, and these patients should be adequately treated with antibiotics, probiotics, adequate hydration, and you should also see it for the red flag signs, which are alarming signs, like if there is massive bleeding through the stools, if there is excruciating abdominal pain, and there is a acute distension of abdomen with guarding, which and the medical advice should be sought immediately. Then typhoid fever. Typhoid fever is a fever which is caused by Salmonella typhi. The sign and symptoms are fever which is continuous pattern. There is headache. There is malaise and fatigue. There can be erythematous rash. There can be confusion. There is diarrhea. Sometimes constipation, and this typhoid fever is transmitted through contaminated food and water. Some patients can be asymptomatic carrier where there are no symptoms, but they take organisms along with them, and there is sometimes need for blood tests like blood culture, typhoid.m test. These patients require adequate bed rest, antibiotics, hydration. Preferably, patients should be on soft diet. Sometimes the typhoid fever can become severe and come with medical emergencies like typhoid encephalopathy, gastrointestinal hemorrhage, and perforation. Hepatitis E and A are viral liver disease, and these can cause mild to severe liver disease. Usually, they present with nausea, abdominal pain, joint pain, diarrhea, and jaundice. These viral viruses are transmitted through contaminated food, poor sanitation, close contacts, and this is a self-limiting disease where the antibiotic is not required. You need a symptomatic management where you give hydration, antiemetic therapy, and the patient improves. uh, im- and and you should improve the sanitation also. Leptospirosis is caused due to bacteria Leptospira, and the common host is rats. The organism is shed in the urine, and it presents with severe headache, malaise, vomiting, nausea, abdominal pain, diarrhea, and sometimes acute kidney injury. And this happens due to there is improper sanitation, not proper hand washing. So you have to improve sanitation. You have to wash food and vegetables properly, hand washing before cooking, and also avoid infection from animal sources. Antibiotic treatment is given in leptospirosis with adequate hydration. So, as we know that leptospira can affect brain, it can affect heart, it can affect liver, it can affect kidneys. So now we know that the some which are common gut related ailments, but now we come to the what precautions should we take, and what how you should maintain a healthy diet and your gut immunity. So to start with, you should include foods which are high immune boosting foods. uh, so foods which are rich in vitamin C, vitamin A, and antioxidants like oranges, lemon, carrots, papaya, berries. And you should include vegetables like dudi, pumpkin, karela, and these vegetables which are easily digestible like sweet potato, suran, and bell pepper. And garlic and ginger have found to have antimicrobial and anti-inflammatory property, so they should be included in diet. And nuts and seeds like almonds, walnuts, sunflower seeds, they are great source of fatty acids, proteins, and antioxidants. Next is safe drinking water and adequate hydration. So, preferably boiled water, and adequate hydration is required to flush out the toxins. Adequate amount of water should be taken daily, and you should avoid alcohol and excessive amount of caffeine. Also, you should include probiotics in your diet. These probiotics help to maintain gut immunity and also maintain gut microbiota. And this probiotics diet includes yogurt, buttermilk, fermented foods like idli, dosa, which are rich in probiotics. Also practice a proper and good food hygiene. You should wash hands before cutting vegetables, or before cooking and before eating. Also clean utensils and kitchen surfaces properly. Store the food properly to avoid spoilage and contamination, and avoid eating leftover food. Also, eat warm and lighter meals during monsoon, as the digestion process is a little slower during monsoon, and so don't overfeed yourself. So, what are the unhealthy foods to avoid in the monsoon? So, the foods which are not properly stored, avoid carbonated drinks, avoid raw foods, raw salads, undercooked meat and seafoods. Uh, Avoid fried and oily foods. The fried and oily foods are high in saturated fatty acids, which cause increase in inflammatory activity in the gut and slows the digestion process. Avoid dairy products like milk, cheese, which easily get spoiled in rainy season if not properly stored due to humidity. And ice creams lowers the body temperature, and which makes it harder for immune system to fight against infection. So these are the unhealthy foods you should avoid. So in all, I recommend you to take care of yourself in monsoon. uh, Take proper hygiene precautions, dispose the garbage properly. uh, Before having any food stuff, you have to wash vegetables, have a well cooked meal, and include fruits and vegetables in your diet, and be safe and healthy in monsoon season. Thank you.